webinar. It is the first for the year 2024. And this special webinar takes on a very different format. Here we'll be having an engagement between two speakers on the recent BRICS Summit and the highlights from the BRICS Summit. And for today, our speakers will be Prof. Limakatso, Lebina and Katlego, Motlhaoleng. So I'll be doing a brief introduction of both speakers before we hand over to our speakers for the day. Prof. Limakatso Lebina is the Director for Clinical Trials at Africa Health Research Institute, which is also known as ARI. She's an Associate Professor at University College London and one of the South African delegates of the BRICS TB Research Network. She has managed multiple clinical trials and implementation science research studies on HIV, TB, and COVID-19 prevention and treatment. Her work on TB was used to revise the TB screening guidelines in South Africa, while the results from an HIV self-testing demonstration project, which she led, influenced the South African national guidelines on HIV self-screening. Limakatso was the lead writer for the South African HIV, TB, and STIs National Strategic Plan for the year 2023 to 2028. And secondly, Katlego is a TB and HIV public health specialist in the care and treatment branch of CDC South Africa, with almost 15 years of working experience in public health. She also has a PhD she is a PhD candidate at the University of Cape Town. Her experience in TB and HIV program implementation includes ethical and quality management of TB and HIV patients, continuously improving program efficiency, and promoting staff development. In her current role at the CDC, she provides technical guidance for the development, implementation, and monitoring of PEPFAR-funded TB and HIV treatment and research activities. So with that said, I will hand over to our two speakers for today.
Thank you, Lozi, and welcome to all the audience that's on this webinar. As introduced, I'm Katlego, and I'll be having a conversation with Professor Lebina, just getting her feedback regarding the recent BRICS Summit that was held in Durban in December 2023. So, Prof. Lebina, welcome to this talk session. So just to start off, I read an article in the last edition of the TB Think Tank newsletter on the BRICS TB Research Network Summit meeting that was held in December last year. Were you able to attend this meeting? And if so, please share some of the information about the BRICS TB network research work that has been done. Over to you.
Hi, and thank you again for this time and for asking more information about the BRICS TB Research Network. Yes, I was able to attend, but just as a background, the BRICS TB Research Network was established by the Ministries of Health from the 5 BRICS countries. And really the main objectives of the BRICS TB Research Network is to promote and conduct collaborative scientific research along the spectrum from basic to operational research for the development and innovation on diagnostics, vaccines, drugs, and regimens, new regimens for TB infection and for TB control, as well as to improve service delivery for people living with TB. And like any other organization, they also have a vision and a mission. And the vision of the TB BRICS network is to end TB in all BRICS countries. And their mission is to accelerate collaborative research and development to end TB in BRICS countries. Some of their values include mutual trust, transparency, evidence-based approach, and knowledge and resource exchange among the BRICS countries in relation to TB. Thanks.
Thank you so much, Prof. Lebina. So I've taken note of the vision, the mission, as well as the values that you've shared. So in terms of this BRICS TB Research Network, can you tell us how and when it was funded? We'd like to find more about, how this network was founded. If you can share some insights into that.
So the BRICS TB Research Network was founded about 5 years ago in 2017. Its members are representatives of the Ministry of Health from each of the BRICS countries, as well as nominated researchers or research organizations representatives. The secretariat role rotates depending on the country that is chairing for the year for the overall BRICS network. For this year, 2024, the Russian Federation, for example, is the secretariat. And last year, because South Africa was chairing all the BRICS sessions and meetings, South Africa was also the secretariat for the TB Research Network meeting. And their website, they do have a website that is currently being hosted by the South African Medical Research Organization. So we can also encourage people that are joining online, if they want to find more information about the BRICS TB Research Network, to visit the SAMRC website, or just search SAMRC BRICS TB Research Network. One should be able to access it. And they have the World Health Organization as a valuable partner since the inception of the BRICS TB Research Network. And they have a lead from the Research for TB Elimination Global TB Programs leadership that always joins all the TB Research Network meetings for BRICS.
Thank you so much. I think I appreciate hearing about the chair and secretariat roles that have been in place between the two countries, as you mentioned, and again the valuable partners that are involved in this network. Lastly, I also appreciate you sharing where people can be able to access more information about this TB BRICS TB Research Network. So thank you so much for sharing that information. Now, moving along. What are the BRICS countries interested in collaborating on TB research? I think we've heard a lot about TB research being conducted, but particularly for the subject matter at hand, we want to hear more. Why are the BRICS countries interested in collaborating on this subject? Over.
Yeah, so all the BRICS countries have quite a high prevalence of TB. In 2022, the BRICS countries accounted for 38% of the global TB notifications and 35% of the mortality related to TB. And most of them also contribute to quite a large proportion of drug-resistant TB cases. So if all the BRICS countries could come together to eliminate TB, just like this year's theme of the World TB Day says, yes, we can end TB. If TB has ended in the BRICS countries, we would have solved quite a large proportion of the TB problem. And also, there's been quite a lot of negative impact on the fight against TB related to the COVID-19 pandemic. And the BRICS countries also think it's prudent for them to come together to see how they can continue to work together to recover and get back to where they were prior to COVID, or even exceed some of those achievements. India seems to be on track to reach the end TB targets by 2025 based on the programs they are currently implementing. Although the countries have a high prevalence of TB, there's also differences between the BRICS countries. South Africa is one of the ones with a high prevalence of TB and HIV co-infection, which is unique to the BRICS country. Also has a high prevalence of drug-resistant TB. And India and China, I think their TB prevalence is per 100,000 is slightly lower, but because of the large population sizes, they have a high absolute numbers of people living with TB in their countries. And as we have heard, there's been a lot of talk about BRICS Plus. There's a talk to increase the collaboration or the networking to include other additional countries like Iran, Saudi Arabia, Egypt, Argentina, UAE, and Ethiopia. We don't know what will this mean in terms of the BRICS TB Research Network, as these additional countries or the BRICS Plus component the new countries only contribute 2% of the global TB notifications.
Thanks, Prof. Lebina. I think it's quite encouraging to hear that, all these countries, they gathered together to address a common concern, which is ending TB. While, countries have got their differences, like you mentioned, South Africa has a high TB HIV co-infection, and also mentioned the good progress that's been done by other countries. For example, India being on track. I think we appreciate, that all countries, they came together to collaborate in ending TB. Now, moving along then to the next question that I have in mind is, what are some of the achievements of the BRICS TB Research Network since it was founded?
Yeah, that's a very good question. Thank you. It's very difficult to bring people together. And I'll put it as an achievement then that there has been 13 meetings of the BRICS TB Research Technical Network since its inception. Each country has had the opportunity to host at least one meeting. I think South Africa has hosted twice in 2018 and of course last year in 2023 following the summit. Some of the meetings were held virtually. As you know, during the COVID-19 pandemic period, travel was restricted. And some of the successes or activities that have been done under the BRICS TB Research Network include mapping of the TB scientific landscape on the research that is ongoing among the BRICS countries, and creating that bibliometric analysis of the networks and what research is ongoing. And this has actually been published and it can be accessed on the various platforms. There was also quite a lot of effort to provide funding and be involved in research during the COVID-19. Researchers from South Africa participated in 7 of the 12 successful projects under the BRICS STI COVID-19 call that was launched in July 2020. Some of those activities or projects included a COVID-19 network for genomic surveillance in Brazil, Russia, India, China, and South Africa. Impact of COVID-19 on clinical manifestation, diagnosis, treatment outcomes, and immune response for pulmonary TB. It was called the Apricot Study, funded or in association with the BRICS Research Network. And then another one, just another example was epidemiological impact and intersection of the COVID-19 and TB pandemics in Brazil, Russia, India, and South Africa. So there have been numerous projects that were funded or co-funded by the BRICS TB Research Network that various countries were able to participate in, and 7 of the 12, as I said, included South African researchers. So I think it has been able to achieve its mandate on increasing collaborative research among the BRICS TB research, the BRICS countries researchers. Thanks.
Thanks, Prof. I think it's quite interesting to hear about the mapping exercise that was done in terms of, looking at resources that are available for research. It will be quite interesting, as you mentioned, that this work has been published. So those that are interested, like myself, I think will get useful information from the publication thereof. And again, you also mentioned the participation of South African researchers in some of the work that was done prior to the summit. And I think that really puts South Africa on the map. So apologies for getting sidetracked about the history of the network, but back to the summit. Was there any call for abstracts? If yes, were they advertised, and how did people get to know about this meeting?
Yeah, unfortunately, there were no call for abstracts. This was the first summit that was held by the network. attendees were by invitation only. The main objective of the summit were to see how we can propose technologies for joint research in the focus area of public health or program implementation, therapeutics, diagnostics, and vaccines, all focusing on TB, to facilitate knowledge sharing among the scientists from the 5 BRICS countries, firming up the network's resource mobilization plan, and using the above mentioned resource to maybe develop another 2 or 3 additional innovative research concepts that could then be set out for deployment, and to see if people could be interested in funding them and others applying for those calls once the calls are available.
That's interesting. I thought it was like a usual conference where, you know, there's a call for abstracts and people can participate. But nonetheless, given that, you know, it was a special structure that was followed for the summit, please tell us more about who attended it, so that we can get to understand for future, you know, participation, who might, you know, be interested, for people who might be interested in participating in such summits, usually who gets to attend such meetings. So yeah, we can appreciate your feedback on that one.
So yeah, we had the BRICS TB Research Network members joining. So each country usually has about 5 to 7 representatives who are part of the network. So those members joined. Then we had our partner, the World Health Organization representatives joining. And because it was held in South Africa, we also held the WHO representatives within the country, within the TB program, WHO joining. And then we had researchers from the BRICS countries, as this was, the aim was to have researchers working on the entire continuum of TB care, for including vaccines, therapeutics, prevention, treatment, and innovative programs. They were invited to join and discuss together as colleagues.
That's really great, especially around the researchers. So can you please elaborate more, particularly on the South African researchers that attended this meeting? Thanks.
Yes, although it was by invitation, I think there was still quite a lot of representative attendance, you know, from the leading research organizations within South Africa, people involved in research, from some of the leading universities or institutions in the countries. And really, South Africa was able to demonstrate the diversity in the kind of research that we are doing, and the people who are doing the research, from the young to the old, males and females, and from the rainbow country that we are.
It's really great to hear about the structure, but just to get to know more about, you know, the participation, was this summit structured like a program? Tell us more about its structure. Thanks.
Yeah, so the program of the summit was structured around the 4 thematic areas, in addition to the usual agendas of the network meetings and the political component of the meetings. Of course, it was opened by Department of Health, South Africa delegation from the Ministry of the Health Minister's Office. But the 4 thematic areas that the researchers and the network members were really focusing on in their deliberations were TB, public health or innovative program implementation, TB therapeutics, TB diagnostics, and TB vaccines. And there were 2 parallel sessions at each time, and there were a total of then 6 sessions. And the presentations by the country program leads, the scientists, and the World Health Organization. And actually, the timing of each session was allocated half the time for presentations and half the time for discussions. Really, the aim was to stimulate discussions, share ideas, share possible concepts based on the knowledge that has been generated from the various countries, and then identifying where the gaps are, where the BRICS countries can together fill those gaps with the relevant scientific research.
That's really interesting to get to know about the structure of the meeting, particularly around the thematic areas. So as you spoke about them, I just paged through the network webpage, and really I could see that these thematic areas are aligned with the objectives as well as some of the core values that the network wants to focus on. So that it was really great to see that being translated into the structure of the meeting. So now, what were your key takeaway messages from, the summit that was held in Durban?
Yeah, it's always a difficult one to try and compress what I learned over 3.5 days and more into a few minutes discussion, but I'll try. Some of the key takeaway messages for me, maybe to also highlight some of my personal interest on TB research, was on latent TB. So Brazil, China, India, and Russia have increased diagnostic approaches for latent TB screening, utilizing IGRA and TST, as well as other newer TB skin tests that have been recommended by WHO. And Brazil also shared lessons learned on implementing IGRA testing within their Department of Health facilities. I have been involved in various studies that have used IGRA to check if people have latent TB or TB infection. And it's not an easy test. It requires about 4 tubes to be collected, and the blood has to be at a certain level, not too much, not too little, and it has to reach the laboratory within a short space of time. And they shared how they had challenges implementing this within a program, and how they've overcome some of the challenges. And one of the lessons for me was that facilities that were furthest away from the laboratory had to be excluded from this program, as samples could not reach to the laboratory on time. But at the same time, despite the challenges, they were able to increase the uptake on TB preventative therapy. I guess it's something to tell somebody, I have tested you, your body shows that you have TB infection, and it's recommended that you take this treatment for 3 months or 1 month or 6 months, depending on what the program offers, compared to what we're doing currently in South Africa. And we, among the BRICS countries, we are the only country that provides TB preventative therapy based on risk. Knowing as we provide it for people that live with HIV, people that are contacts of a person living with TB. And I think each of those approaches has pros and cons. The providing a test also means multiple visits are required for screening before you can initiate somebody on TB preventative therapy. And as we've also seen in the case of Brazil, the feasibility is very complicated to offer a TB screening test. And there's also laboratory costs associated with that. However, our approach in South Africa of treating on risk can also increase the risk of people that are being exposed to drug unnecessarily. Maybe some of them should not have been treated if we were testing them. But that's the approach that seems to be working in South Africa currently. Thanks.
Thanks, Professor. I think this just provides, an overview of, some of the work that has been done in other countries in screening for latent TB. And we hope that, best practices can be learned, well informed by the work that has been done by other countries. So
yes,
we really appreciate those key takeaways. Yes, go ahead.
Yes, sorry. I was just thinking that was one. Maybe let me share 2 more. All the BRICS countries were also involved in a lot of TB vaccine research at different levels or stages, whether new molecules being developed or phase 1 to 4 clinical trials. And we also learned at the meetings that WHO Vaccine Accelerator Council, BRICS countries are already involved. I think we have 2 members of that council coming from 2 BRICS countries. And it was decided, or it was a recommendation from the network, that instead of having a parallel structure trying to accelerate TB vaccine research, the BRICS countries will aim to work through the WHO Council to provide input on TB vaccine research. And lastly, one of my big takeaway messages is that India is providing nutrition support program for people or families affected by TB. And this includes crowdsourcing initiative to support these patients so that they can have food and improve treatment outcome and adherence, and also augment community involvement and leverage corporate and social responsibility. So they actually approach companies in the area where the person living with TB could be, and say, in this community, as Toyota and your dealership is based here or your factory is based here, we have so many people living with TB. How many families can you be able to adopt? And if that company then adopts them every month for 6 months to a year, then they send a standard food parcel package for that family. And they have 4 models of distribution of these food parcels, and they've reached over 1 million people with this initiative, and it has really been well adopted by both companies and community structures that want to help, as well as people living with TB as they receive these parcels. And it shows how research can translate into policy change, as we all read the latest article that was published last year from India that showed that nutrition for TB prevention works as well as a vaccine.
Thank you so much, Professor. We really appreciate that. Then, given that, a lot really transpired during that summit where all the countries were able to present what they are doing, what are their key challenges, do you think that the summit achieved its objectives?
I think so. I think we had a good 3 days of discussions and deliberations. People shared ideas. And I think at the outset, the idea was to get 2 or 3. I think we got more than 3 new innovations in therapeutics, diagnostics, and or vaccines that the network can prioritize for investment and development. There was a clear roadmap on how we're going to achieve some of those things. Of course, there are still some outstanding things like a funding strategy to be strengthened. That's still work in progress, but I think the building blocks were put in place, and we look forward to hearing more from the BRICS TB Research Network on these things as they continue to be developed. Thank you.
Awesome. So just in closing, what can we expect from the TB BRICS network in the future?
I think for the general person, there will probably be another call for proposals once the funding has been sorted, but there's a clear direction in terms of where the BRICS TB Research Network will be focusing on those 4 areas. Vaccines is a big issue, and new regimens. Thank you.
Professor Lebina, thank you for taking time to share valuable insights regarding the TB BRICS Summit. Your insights and perspectives are greatly enriched our understanding of the network, and your thoughtful responses also provided valuable depth to the discussions. I really enjoyed having this conversation around ending TB. I will hand over then to the TB Think Tank Secretariat for a small pause before we can move on to the next session. Over to Lwazi and Mtogo.
Thank you, Katlego, and thank you, Prof. Lebina. So as Katlego has said, I would like to remind you that if you have any questions or comments, please do enter them at the top of the right-hand corner of your screen under the Q&A tab. And as well, I would like to remind everyone that if you'd like to see yourself on this platform in the upcoming months, please do email myself at nkosi@tbthinktank.org. And just to remind everyone that we have now ushered in the new month of March, and I'm sure everyone on this platform knows that March is TB Awareness Month, and the theme for this year is Yes, You and I Can End TB, and that is the theme for World TB Day, which is on the 24th of March. I think now I am ready to hand over back to our speakers for us to get back to our engagement. Thank you.
Thank you. And yeah, good afternoon and welcome to our session. For those that joined us late, we just want to let you know that this session will take a different format as we are giving feedback from the BRICS TB Summit, and we will not have any slides or presentation, and hope though you still find the discussions useful. And in this segment, I would like to welcome one of our honored guests that was able to join the BRICS TB Summit that was held in December 2023, and hope that her memory still serves her well to share with us what she had at the summit. So welcome, Katlego, and thank you very much for taking the time. And I'll just ask you a few questions, but yeah, maybe for you, what were the highlights of the BRICS TB Summit?
Thanks, Professor Lebina, and particularly for having me to share some feedback around the summit. There were a lot of highlights, but just in the interest of time, I think I just want to mention that the summit was well attended by members of the BRICS countries. There were meaningful discussions on ending TB that were fulfilling. I think one of the key highlights was how the meeting was organized into specific topics that are related to the key thematic areas of the network. So overall, the high-level participation from subject matters experts was really key to these meaningful discussions. And South Africa in particular had an opportunity to showcase their TB delivery aspects where, there was a site visit conducted at one of the hospital, King Dingizulu Hospital in KZN, as well as the two clinical research sites that were visited, Caprisa and Ari in Durban. So those were the key highlights where, the country managed to well articulate some of the successes and, also acknowledge the challenges that are faced within the TB space. So the overall structure of the meeting was an highlight for me. Thanks.
Yeah, thanks. You just reminded me. One of the things that I really didn't appreciate is the ability to allow people to speak in their own languages. So as South Africa, as the host country, organized that there will be translators, and people were presenting in Russian, in Portuguese, and we could then put on the headphones and listen to what they were saying. Yeah, it was really a different experience. And they could not stop congratulating South Africa for getting it right, that they could speak in their own language, even though they are very far from home. And it made the discussions more robust because people were comfortable to express themselves. Can you also share insights into the best practices that you learned from the BRICS countries? And maybe just to make it easier for yourself, if you can, we can start with TB programs.
Thanks. Yes, because there were a lot of best practices that were learned. Just to start off with TB programs and also including public health within that. First and foremost, it's Brazil, where they shared their implementation on strategies around homeless populations. It is well documented that homeless people they have a very high treatment loss to follow up, and there's a strong association with mental illness as well as drug abuse. So it was quite interesting to hear about the interdisciplinary approach that Brazil has put in place to address issues around homeless populations. Then again, just looking at China, they're also implementing a similar approach, but they're looking at health education, mental health, and nutritional support. And these were really great insights and best practices that were learned around some of the strategies that are done. India also implements a nutritional support. We know that with the TB program, one of our challenges is patients that would have nutritional challenges. So the strategy that India implements in terms of ensuring that there's nutritional support to TB patients was really fulfilling in terms of, learning best practices and seeing how best those can be adopted and mimicked in our local context to address some of the gaps. So those were the key highlights around program implementation. And I think others, they will come on as we continue with the conversation. Back to you.
All right. Yeah, thanks. Yeah, I think the homeless people has not been really a big focus in South Africa, and maybe we also need to review our strategies for retaining them in care. I think I've only seen one study that was presented at the last TB conference on addressing retention for homeless people within KZN. And any lessons on diagnostics?
Yes, there were key lessons that were learned on diagnostics. I think one of the key things that we learned was first and foremost screening for latent TB, as you mentioned earlier on in your session, because that is the first key step that makes it easy for patients to be, flowing through the cascade of care. So in terms of diagnostics, we really learned a lot in terms of innovation, where countries like Brazil have really done an assessment to look at different lab platforms, particularly around cost effectiveness. India has also done the same, and I think we appreciated the work that has been done through CDC China in improving technologies and ensuring that diagnostics really do improve, particularly for China and India. They mentioned the use of tools that are effective, particularly for children. Brazil also mentioned the use of CAT and other tools, diagnostic tools such as urine and stools, which I think really is what is needed for pediatrics. Russia mentioned the use of diaskin test that was used since 2009, and they've really made great strides in improving diagnostics in that area. So it was also quite interesting to hear about the whole genome sequencing done in Russia, and I think South Africa also shared some of the best practices that has been done around whole genome sequencing for DRTB. So yeah, they were novel solutions that were also presented around the TB diagnostic space, and it's quite a lot. I think as we proceed, some of them will come into the discussions. But I think appreciation is that there is movement from the BRICS network towards the WHO recommended tools for TB diagnostics. Back to you.
Right. And anything on vaccines and therapeutics, just as you are thinking about it, I think I remember there were also very interested members from the other countries in how South Africa has implemented the digital chest X-ray, especially placing it in the communities for TB screening. And they're really looking forward to hear more about that maybe in our later meetings. So yeah, that was one interest of them, and they were interested in our algorithms and how we see who should be treated based on digital chest X-ray. But yeah, anything that you remember that you learned on vaccines or therapeutics?
Okay, maybe let's start off first with therapeutics, then we will move on to vaccines. So around therapeutics, I would like to divide it into three thematic areas to make it easy. Just looking at the DSTB treatment, I think there's been movement towards new drug treatments, even shorter duration treatments. Brazil mentioned a super booster that has been put in place, especially for co-infected patients. Similarly, India also mentioned DSTB fixed dose combination, which makes it easy, particularly for the dots. Russia mentioned a treatment combination approach, which includes, treatment for symptomatic patients, pathogenic treatment, chemotherapy, surgery, and endoscopic treatment, just to mention a few. South Africa came on top in terms of new DSTB regimens, shorter regimens, for both adults and children. However, given the high HIV TB co-infection in South Africa, we also noted the reluctancy at that stage for South Africa to move towards the 4-month DSTB regimen due to this high co-infection. But they did announce that the work is currently in progress, and I hope with the updates that are coming from the NTP, we'll be moving more towards the shorter DSTB regimens. China has also started rolling out better drugs that have a shorter duration and that are host directed therapy included. So TPT is also part of therapeutics. So countries like Brazil and Russia have really done great strides in ensuring that there are shorter, safer regimens that are being rolled out. South Africa was also put on the map, given the revision of the systematic screening, which makes leeway for us to be able to identify eligible groups for TPT. And, with the work that was done from the 3TB trial, I think it has really informed a lot in scaling up 3HP in South Africa, and we hope with the Dolphin 2 study, it will inform on provision of TPT, particularly around naive individuals. So there's a lot that was done around therapeutics. China also mentioned a 4-month treatment, TB treatment prevention, treatment that's currently in use in their country. So it was good to hear that, there's that move towards shorter TPT regimens in the BRICS countries. With DRTB, again, shorter regimens also, came out as a common theme across all the BRICS countries, and in particular, South Africa mentioned the BPAL-L as a shorter RRTB regimen that's been rolled out in the country. And those other countries were really interested in how South Africa has made strides in DRTB treatment. I hope that sums up in terms of therapeutics.
Yeah, no,
Over
thanks. Thanks, Katli. Maybe in 30 seconds, anything on vaccines? I'm just surprised how time has quickly flown by. It's almost 1:45. So we have about 7 minutes or so to try and finish and wrap up. So maybe or something on vaccine, and then we'll try swiftly move along so that we can allow people for some question and answer.
Okay, so in terms of vaccine, shortly, countries like Russia and India, as well as China, they mentioned a lot about the work that has been done around BCG vaccination. India, in particular, they spoke about revaccination of adults above 18 years. But I think the common consensus was that despite the parallel work that's been done, there's a greater need to collaborate with WHO and looking at avenues for accelerating towards, ensuring that there's the TB vaccine work that's been concurrently done by all the BRICS countries. So it was quite interesting that they've touched on the BCG, but identified that there's a need to move towards more efficient and effective TB vaccines. And I think for developing countries like South Africa, it will be quite interesting to see how and when that will take place in countries like us. Thanks, and back to you.
Yeah, no, thank you. I think on everybody's mind, and probably the reason why many people joined is they want to know what are those collaborative projects or initiatives that were proposed or discussed as, things that the BRICS countries could work together on as part of our ending TB.
Thanks, Professor. I think that just leads on to the previous response that I provided. I think in terms of collaboration, there is consensus for the countries to collaborate in all the 4 thematic areas that have been identified around program implementation and public health, diagnosis, therapeutics, including prevention, as well as vaccines. Following the mapping exercise that was done, I think consensus was around supporting the WHO TB vaccine acceleration, as well as maintaining the website for the network so that it can bring up awareness regarding the collaborative work that has been done and that will continue to be done within the TB space. I don't recall if there's anything else that was key that I may have missed, but you're welcome to be part of this conversation in sharing some of the collaborative work. But I think what was key, given that, in terms of therapeutics, we agree that shorter regimens is the way to go. Diagnosis, we agree that innovative tools is the way to go. But I think a lot still needs to be done around the vaccine, work and then collaborating with WHO as the major partner for the network. I think it will help, and we look forward to hearing more about the development in that space. Back to you.
Yeah, thanks. Yeah, I think some of the other, it's still around the same thematic areas. Really, I think vaccines was one of the top priorities that people said there needs to be a focus, including making sure that there is continuous advocacy from the researchers and the BRICS network to support vaccine research for TB. And secondly, we need more point of care diagnostics that use other samples other than sputum. I think that was also one of the main discussion points to say how can we work together to improve diagnostics for TB. But finally, did you hear any plans or strategies on how this BRICS network thinks it can pull it all together and make it happen? Thanks.
So I think in terms of the strategies, as you mentioned, first of all, there was acknowledgement that a lot of work has been done, and then there's been prioritization of resource allocations. First is to identify what are the key strategies that the summit will be looking at. And once that has been done, then there will be resource discussions around interventions that will be implemented. It was not a decisional meeting, if I recall well, but a declaration was to be published in terms of highlighting the key areas that will be prioritized for funding. I believe TB vaccines will be a part of those priorities. You're welcome to add if there's anything that we've missed. But I think what would be interesting is to look out for the declaration that will come out from that summit, because a draft was presented, but the BRICS countries requested that they go back to their respective countries for their insights and concurrence on that declaration. And I think it will point the direction in terms of resources and future collaboration on work that still needs to be done. But I think the consensus was keeping the key thematic areas. You're welcome to add if there's anything that I have missed.
No, thank you. I think it's all covered, and I think then that will be the big outcome of that meeting as well, to have that declaration accepted by the countries and shared with all interested parties. And really the aim is to really increase collaborative research among the 5 BRICS countries. There's still no clarity of what will happen when we become BRICS Plus. But TB continues to be a major problem in the BRICS countries. And as the theme says, yes, we can end TB, and BRICS can do a big part of that. Thank you. And thank you for the organizers to allowing us to share. And we apologize for taking a different format, but hope it was useful. Thank you.
Thank you, Prof. Lebina, and thank you to Katlego. And I would like to thank you as well for the unique style and unique delivery of today's webinar. I also just would like to remind people to please tune in on the 18th of March. We have our webinar where we'll be taking a closer look at the Global TB Report, and there we will have a speaker from World Health Organization South Africa, as well as World Health Organization from the Global TB Program. We have a question for our speakers. I think you might have touched on it, so perhaps it would just be providing more clarity on this. This person asks, are there any specific collaborative areas that South African researchers should consider with BRICS colleagues?
Yeah, Katlego can go and then I'll end. Thanks.
Yes, thank you for the question. So in terms of collaboration, it's around the 4 thematic areas which we spoke about during our conversation. The first being program implementation, including public health. The second being TB diagnostics, as Prof. Lebina has mentioned, that there's a need to move towards more point of care testing, as well as improving, TB diagnostics broadly by making use of innovative tools and solutions, digital chest X-rays, using CAD and other tools as well. And I think one area that we can point out is TB diagnostics around children and adolescents. As we know, these are the populations that often are missed. So these were some of the areas that were discussed during the meeting. Moving on to the third thematic area for collaboration in research is on therapeutics as we move towards shorter regimens. This includes both DS and DRTB treatment regimens, as well as TB preventive regimens. We know that, for example, South Africa has scaled up 3HP in people living with HIV, but I think there's still room, to do more in terms of TB preventive treatment. So this is one area of collaboration that we could be looking at to learn at, to look at what other BRICS countries were doing in that area. And the last one is TB vaccines, where we highlighted that instead of the BRICS countries doing parallel work, they've agreed that it's better to collaborate with WHO, focusing on the TB vaccine acceleration component. Professor Lebina, I think I've covered that collaborative work around the 4 thematic areas. Please add if there's anything that I missed.
Yeah, one of the other things that was touched on was also on surveillance. All the BRICS countries, followed the recommended WHO data collection for surveillance, but maybe to harmonize that even better for hotspot detection, TB positivity surveillance, resistant surveillance, so that the data can be easily comparable between the countries. Also to help with multi-country validation of new tools so that we can support regulatory approvals. If something has been tested in the BRICS countries and the data can be easily combined or analyzed together, then it's easier for an organization like WHO then to pass it or recommend it if the data is convincing enough. But yeah, I think the whole idea is we need to find new tools together because as all the reports show, unless we implement new tools in addition to what we're already doing, it might be difficult to win in the fight against TB.
Thank you so much. If anyone who's attending still would have a question after we've ended the live, please do email anyone at the Think Tank Secretariat and we'll make sure that our speakers get your question. I think we have a question or comment that has just come in. This is a comment that's both. It says, thanks for the excellent overview of the highlights. As you mentioned that India is taking the lead on investing in interventions to deal with socioeconomic drivers of TB, like nutritional support. What do you think it would take for South Africa to invest in such interventions as well?
Yeah,
I
I think
try
South
to go
Africa.
first.
Yeah.
Okay, go
Oh, yeah,
ahead,
yeah.
Prof.
I was just going to say South Africa has already started. It has taken a different approach. We know that there's a grant for people living with TB that can be accessed if somebody has been initiated on TB treatment as part of that support. But I think the India model is more inclusive. It's not about what government can do or what the Department of Health can do, but it's all about what the whole community can do to support people living with TB. And as the theme says, you and I can end TB. So it starts with all of us on this platform to say, what can I do where I'm involved in my community to provide food parcels for people living with TB? And it's the companies, it's the communities, it's the churches that can take a role in that.
Thanks, Prof. And maybe just to jump in on the conversation, I think we need to really look at the multi-sectoral accountability framework, as it doesn't just include one department. For example, Department of Health alone cannot address issues related to nutrition without bringing in other stakeholders. So I think by implementing the multi-sectoral accountability framework, we'll really make strides in different areas, nutrition being one of them. For example, this will allow opportunities to bring in other important sectors, such as Department of Social Development. So I think in a nutshell, when we attended the Union Conference this year, there was a WHO session on ensuring that, people are aware of the multi-sectoral accountability framework, which South Africa has also made stride in ensuring that it's well documented and well articulated. This will ensure that different departments and sectors are brought together to address, the socio-economic challenges that South African populations are faced with. Thanks.
Thank you for that. We have just about 4 minutes to go, but I think Toi can confirm, I think we can close the live. I'd just like to remind people again that if you'd like to see yourself or anyone that would like to be on this platform, for them to email myself at ngosi@tbthinktank.org. And with that said, I'd like to thank our speakers, our presenters for today. Thank you again for the unique delivery, the style, the conversation. Thank you and for your time. And thanks to everyone in attendance. And please do enjoy the rest of your Monday and have a productive week ahead. Thank you.
Thank you.
Thank you.